From the News Channel 5 Network, this is Medical Mondays.
Good evening, everyone. I'm Carrie Sharp. Welcome to Medical Monday. Not open line tonight, Medical Monday, but that means it's your chance to call in with your medical questions. And we have Dr. David Gnewikow here with us from Advanced Hearing Solutions in Mount Juliet. Thank you for being here once again.
Thanks, Carrie. Nice to be here.
You're an audiologist, so we're talking obviously about hearing loss and hearing solutions. So if folks at home have a question that deals with hearing loss, maybe you're wearing a hearing aid right now and it's not exactly working right, now is the time to call in. 615-737 is the number to call. It is right there on the bottom of the screen. Welcome back. We love having you on.
Thanks. I always enjoy it.
We're learning a lot, but I want to just start with the very basics. I know that there are people at home watching right now elbowing somebody else saying, this is the show for you. I've been telling you to get your hearing checked.
Right. In fact, we get that almost every time I come in and do a show. We get a call the next day that said, I watched your show and I told my wife that, or I told my husband. And so yeah, give us a call, ask some questions. I'll be glad to kind of help answer some of those.
What are those key signs that somebody does need to get their hearing checked? There's an issue.
Right. So there's several signs of hearing loss. I mean, there are the obvious ones of misunderstanding or just having to turn that TV volume up a little bit. But the more subtle signs, kind of the first indicators that there may be some problems, a lot of times it is what we call tinnitus, or ringing in the ears. Several times we've gotten calls about that. That doesn't necessarily mean that there is hearing loss, but usually it can be indicative that there might be some damage going on. Hearing loss usually shows up in more difficult situations first. So most people with a mild to moderate hearing loss can hear me fine. I have a loud, strong voice, especially face to face. But the problems show up maybe with a softer voice, or maybe with the kids or grandkids, or in a restaurant, or hearing that person in the classroom, Sunday school class across the room. You know, it is situations that require better hearing to be able to understand. As I said, I talked to a lady today with a very severe hearing loss. Her hearing aids are out and she can still communicate with me with a strong voice. As you mentioned, low frequency. So generally problems are going to show up first in the higher pitches. So that's problems with female voices. And that's problems with children's voices. Those are usually what we see first.
How can you encourage someone to get their hearing checked? Yeah,
that's a question I've tried to answer many times. I don't know that I have the very best answer for it. What I encourage people to do is just to take that first step of having a test done. At our practice, Advanced Hearing Solutions, we're in Mount Juliet, Tennessee. We do a first evaluation at no charge. I have lots of people come in who have honestly pretty good hearing. You're not ready for me to talk to you about a hearing aid, or it's just, you know, I'm noticing that things aren't quite what they used to be. And we're establishing a baseline with that person. So maybe at 50 or 55, we're saying, okay, here's where you are in 2018. You're not to the point where we're going to do anything yet, but let's look at that. Let's look at that more maybe as time goes on.
I want to talk about what happens during the first visit in just a minute, but Lewis is on the line. Always love to jump to the calls. And by the way, if you have a question, go ahead and give us a call now. We'll get you lined up. Lewis, thank you for calling in. What's your question?
I would like to know why I hear like birds tweeting off a lot of times in the distance.
Do you have a hearing aid right now?
No, I don't have a hearing aid, but I can hear like birds tweeting off sometimes in the distance.
So I think what Lewis, it is Lewis, right? I think what Lewis is talking about is what I was just mentioning, and that's called tinnitus. And different people describe it differently. It's a ringing sound, or it's a bird chirping sound, or I've heard it described many times as the cicadas. You know, when we have the cicadas that it is an internal sound. I can't hear it in your ear. I can't measure it in your ear, but it is usually a sign, as I was saying a few minutes ago, that there may be some damage to the hearing, especially people who have been around loud noise, been exposed. Sometimes it can be exposed to different medications. Personally, Lewis, I have it all the time too. I think I shared this when I've been on this show before. I've been an outdoorsman. I've done chainsaws and guns and those type of things. But when I was 20 years old, somebody shot a high-powered rifle very close to my ear, and it's been ringing ever since. So 20-something years of listening to those same birds. There's not really a cure per se for ringing in the ears or tinnitus, but most of the time, if those individuals have enough hearing loss to where a hearing aid can help them, hearing aids are very effective at alleviating some of those symptoms, simply because we can hear more, and so it tends to cover up some of those internal sounds going on. But I think that's what you're talking about, Lewis, and I think that's what's going on.
All right, very good. So if you say, you can't hear it when you're checking someone's ears, what is causing that? I mean, That's
an excellent question. So I should have an ear diagram up here
Yeah.
to go through. But basically, here's how the ear works. This is a very quick version of this. Okay, sound comes through the ear canal. It hits the eardrum. The eardrum's just like what it sounds like. It's like a bass drum. And so that eardrum is set into vibration. There's some little bones on the back side of the eardrum. Malleus, incus, and stapes. We'll ask all you people for a quiz later, okay?
Don't.
But basically, the sound vibrates through that and gets to the inner ear. And in the inner ear, there are thousands of what are called hair cells. And hair cells are essentially the nerve endings of hearing. So as the sound vibrates, these little cells that have little hairs or cilia on top of them will deflect. That creates an electrical charge. It fires the nerve ending. It goes to the brainstem in your brain. That's how you hear. 7 years at Vanderbilt for that. I hope you appreciate that. Now,
you're probably still paying that bill, right?
Yeah. Now, I don't say that because you have to understand that. But what happens with hearing damage most of the time is those little hair cells, I'm doing my little fingers like this, those little hair cells are damaged. And so my job as a hair cell in the inner ear is to fire when they hit my frequency. So think about a piano keyboard. If you hit a middle C or you hit a high C, there are hair cells tuned to those different frequencies. Well, what if I'm damaged or broken, or even sometimes they're not even there anymore? There is this firing going on that's almost like a shorted out circuit, because the brain says they're supposed to be, I'm not hearing something, okay, I'm going to turn it up a little bit more. And the best way to describe it to me is a shorted out circuit. And what I hear is my ear going, there's a sound there, there's a sound there, whee! I'm hearing this kind of tone going all the time, but that's basically due to damage to those nerve endings.
That's
probably more than you wanted to know.
I love it. I mean, with the imagery, it makes sense. I appreciate that. Let's get to Barbara here on the line. Barbara, thanks for being part of the show. What's your question? Go ahead, Barbara. I can hear Barbara listening to her TV. Are you there, Barbara?
Yes.
Okay, good. Go ahead with your question. Make sure you're listening into the phone, okay?
Okay. I don't have ringing in my ears, but I hear water running, like the faucet is running.
Yes, so unless your faucet is running, that's probably the same thing. And different people will perceive that internal sound differently. So I've heard it as water running, rushing, high frequency. A lot of that has to do with the part of the ear, the part of the inner ear that might have a little bit of damage. So usually when somebody says rushing or water running, it tends to be a more low frequency problem. Problems with the lower pitches. A ringing or birds chirping or cicadas tends to be kind of a higher problem. But it is, I believe, again, I'm kind of diagnosing over the television, but I do believe it's kind of the same thing. It just may be some of those cells damaged in a different region.
So what causes this? Is it due to age, or is it due to an actual injury to the ear?
It can be a lot of things. So anything that affects hearing can affect tinnitus, ringing in the ears as well. I hate blaming age on things, you know. I mean, certainly we all talk about, well, you know, some things in our body don't work as well as we get older. But usually hearing loss, there's two primary causes for hearing loss. Noise exposure and genetics, and probably not in that order, probably genetics and noise exposure. So if you see someone who is in their 60s and they haven't been around noise, why do they have hearing loss? Well, it's a genetic issue. It's that, you know, my brother or my dad or my granddad, and so that's usually what the cause is. Now, certainly we can talk about guys that have run chainsaws and been around loud things, and that can cause it. And there are other causes for hearing loss, but the primary two are going to be genetics and noise.
Okay, Marilyn is on the line. Marilyn, go ahead with your question.
Yes, I have a twofold question. I have a lot of pain in my ear at different times, and when I wash my hair, if I get the least amount of water in my inner ear, it's like just really, really painful. So is that, and then I do have some problem with hearing when there's a lot of background noise at the age I'm at now. So does your company handle other things, just, you know, other than hearing loss, if you have another problem going on?
Right, that's an excellent question. And so first, let me give you a disclaimer. I'm an audiologist, which is a doctor who specializes in hearing. Usually if there is a medical problem, pain, those type of things, we refer to an ENT, or ear, nose, and throat doctor, also called an otolaryngologist. So I will, again, kind of give you my advice over the television. It sounds like you have a hole in your eardrum. Now that sounds terrible, but it's really not that big of a deal. Lots of people have that. Actually, in kids, if you've ever heard of putting tubes in kids' ears, we're actually physically poking a hole in the eardrum, not me, the ENT is, to alleviate pressure. And so that usually, if getting water in there causes a lot of pain, that can be an indication that there is a hole in the eardrum. I would definitely recommend seeing an ear, nose, and throat specialist, have them take a look. There are different things they can do, anywhere from treating it, making sure that you don't get an infection, to even going so far as patching it. Now, I can't tell you definitely that's what's going on, but that really sounds like where the problem is. And to kind of follow up, that certainly can affect hearing. Depending on where that hole is, that could make hearing a little bit more difficult if the eardrum's not working properly.
All right, interesting question. We haven't had that one before.
No, that's a new one.
Thank you for calling in. We also have Joyce on the line. Hi, Joyce.
Hello there.
Hi, go ahead with your question.
My question to the doctor is, when your ears are extremely dry, my ears do not make earwax, and they itch all the time, and I'm constantly, I know this is a bad thing, always I chew on paper and get down there and scratch it all the way down to the bottom.
All right, I'm not going to recommend that. Okay.
I appreciate your giftedness.
It feels so good because you're getting right to the spot. But what I'm saying is, why do they stay so dry and itch, and my ears does not make a normal earwax?
Right, so earwax is made from some glands in your ear that are called cerumen glands. And so just like you might see two people working outside in Nashville on a 95-degree day, and one person is really sweating and the other person is not, different people have different chemical makeup, and different people have different glands. So I see patients who have serious problems with wax buildup, and I see a lot of patients who report exactly what you're reporting, is that my ears are very dry. So I'm going to discourage scratching your ear as much, because that can sort of irritate it a little bit more. The other thing I'll say is that is more of a skin problem than really an ear problem. And so I feel bad I'm deferring all these questions to other specialists, but that might be something that I would talk to your primary care doctor, or maybe even talk to a dermatologist about. I have some patients that'll...
I did talk to the primary care, and she just told me to put a little Neosporin in there.
And that is basically to put a little bit more moisture in your ear. I would say if that doesn't go away, I'd see a dermatologist. They're going to recommend a lot of, again, I'm overstepping my expertise a little bit, but a lot of times they'll recommend like a little steroid cream or something to alleviate that. What you're experiencing is really not any different than somebody who has eczema. So, you know, so if you know somebody who has really dry skin, I get it in the wintertime, and you know, I'll either use over the counter or sometimes see a dermatologist to do that. But I don't think that's specifically something wrong with your ear as much as it is just the skin in the ear getting irritated.
All right, Mary, thank you for your call.
Supplement?
I hope you find some relief. What did you say?
Is there a supplement that you could possibly use to help your ears?
Yeah, I'm not familiar with any. I'm not saying that that doesn't exist out there, but I don't know of any just offhand.
Thank you.
You're welcome. Thank you for the call.
We've had such interesting questions this time.
I know, they're wearing me out.
They're
testing my knowledge.
You work. Okay, I have a question. I'm going to ask it because I'm just going to do it because I know you deal with this all day. Let's talk about earwax.
Okay, great.
Hey, you chose this
field,
right?
I got you.
It actually serves a purpose, right?
Absolutely.
I mean, it's a good thing.
Absolutely. So earwax serves two purposes. One is it is a lubricant that actually keeps the ear skin healthy. So what she was describing is a problem when there's not any, because it can dry out the skin. In fact, if you've ever heard the term swimmer's ear.
Yes.
People think of swimmer's ear as because I got water in my ear and I got an infection. The real reason people get swimmer's ear is because chlorine cleans out all the wax and it makes the ear canal more susceptible to have an infection. So some wax is a good thing. They also say, and I can't verify this scientifically, that wax is a bug repellent. And so Wax has a little bit of a smell to it, and in theory that repels bugs and keeps bugs from climbing down into our ears.
Okay, we have all certainly seen people, or maybe you are one of them, who have too much wax.
Yes.
And I've also heard, don't stick a Q-tip in your ear. Don't stick anything smaller than your elbow in your ear, or something. An audiologist told me one time. So what do you do?
Right. So most people don't have to do anything. I mean, we shower, we wash, water comes in, everybody on every now and then get a little wax out of their ear. That is normal, that is healthy. That doesn't mean that there's anything wrong. So I don't recommend using Q-tips, mainly because if there is a big problem, what happens is it crams it in deeper rather than takes it out. Sorry, all you Q-tip factories out there that I'm discouraging that. There are some over-the-counter treatments, and I won't name brands, but just go into the drugstore where there are eye drops, there are ear drops, and it's just a solution. A lot of times it's a little bit of hydrogen peroxide and maybe a little bit of oil, something that will break that up. They put some drops in, give you a little bulb to rinse out. So that's what I recommend for my patients. If it becomes excessive, then you do have to get it taken care of professionally. So we do some wax removal. If it's deeply impacted, I'll refer to a ear, nose, and throat specialist that have microscopes and those type of things. Most of the time that's not the case though. Most of the time it sort of takes care of itself, but we do see those situations that we have to work on people sometimes.
All right, fantastic. Let's jump back to the lines.
Thanks for that question.
Well, you know, somebody has to ask you, so it might as well be me, right? I mean, we all have these things. Let's talk to Jeff. Hi, Jeff.
Hi.
Hi, go ahead.
Yeah, I have a question. I've got tinnitus. I've had it ever since a kid, and I know exactly why I got it. Because when I was a kid, I had a lot of ear infections. And at one point, they decided to lance my ears. You know what that means? That is basically they cut holes actually in my eardrums to stop the ear infections, and it worked. But my ears have been ringing ever since. Is there any chance or hope for a cure?
Okay, so that's an excellent question. We've talked about tinnitus or ringing in the ears a little bit already tonight. So there is not a cure per se. You know, I can't tell you, well, you need to take this vitamin or you just need to go get this medication. And there's a reason for that. As we just kind of described what tinnitus was a few minutes ago, it is a neural firing. It is a firing of the nerve. And so stopping tinnitus is not as simple as just saying, here, take this pill, because we're talking about nervous system function, which includes thinking and breathing and those important things. So suppressing tinnitus is not a simple thing. There is lots and lots of research going on right now on whether it's pharmaceutical ways or audiologists treating tinnitus to try to improve those things. So as a professional, I can say there are two things that are effective at treating tinnitus. I won't say eliminating it. One is called tinnitus retraining therapy, and you can go online and look that up. There's several audiologists that do that. And it is basically a system through which we teach the brain to ignore that it's there. And there's different versions of this, but basically what it is a device that actually emits a sound into the ear. It's called a habituator or a masker, depending on kind of how you do that. And we're sort of teaching the brain to ignore it. That's one way of doing it. The other, again, I said this a few minutes ago, it depends on whether there is a hearing loss present. But when hearing loss is present, hearing aids are very effective at treating tinnitus. So again, I use myself as an example all the time. I do this all day in my clinic. I have a hearing loss in my left ear. I wear a hearing aid in my left ear. When I take out my hearing aid, my tinnitus goes up 100%. I mean, it doubles in intensity. And that's a very simple reason for that, in that when it's in my ear, I hear all this high frequency stuff in my voice, in your voice, in us shuffling around at the desk. But when I don't have it in, I don't hear high frequency. And so there's nothing to really cover up that ringing going on. So I'm sorry, I wish I could tell you, you just need to do, you know, some jumping jacks and eat Brussels sprouts and it goes away. And if I could do that, I would cure myself. But there's not really a specific cure for it as we know right now.
But interesting, those two methods. Okay, we're going to take a quick break. We've had excellent calls. Keep them coming. We'll line them up during the break. 615-737+ is the number to call. Dr. Gnewikow is in today. Stay with us.